Plastic surgery, love it, hate it, it's here to stay. One of the most recent trends in plastic surgery has been the BBL. No, it doesn't mean Bora Bora lovers. It's an acronym for the infamous Brazilian butt lift. Why is it infamous? What's up with that? Let's talk about it.
Disclaimer: I am in no way telling individuals what to do with their bodies. Instead, I am providing an analysis of the practice, sharing its critiques, and providing information on what would be considered a safe procedure.
If you've never come across the term Brazilian butt lift, or if you don't fully understand it, that's okay. A Brazilian butt lift refers to a cosmetic surgery procedure where fat tissue is removed from another part of the body and is then transferred into your butts by liposuction. I don't know why I said butts. You have two, so it's fine. The fat is removed by liposuction and transferred by injection. It is professionally known as an autologous fat transfer or autologous fat grafting. According to BrazilianButtlift.com, the majority of butt lifts on average cost between $2,000 and $12,000, with the average cost of around $6,500. That's a relatively high cost. However, for a cosmetic surgery procedure, it's actually pretty average. Just to compare, a brow lift costs around $7,125, lip implants cost around $2,500, a thigh lift costs $8,725, and a breast lift costs approximately $8,000. Certainly, you'd have to be making quite some dough to afford this surgery. That is a possible reason why we've seen mostly public figures and online influencers with results from the procedure. And by public figures, I mean celebrities. Since 2015, the amount of butt lifts performed globally has increased about 77.6%, according to a recent survey done by the International Society of Aesthetic Plastic Surgery. It's a very fast-growing cosmetic procedure. Celebrities such as Kim Kardashian, Amber Rose, and Kylie Jenner have been rumored to have the surgery, but none of them have actually confirmed it. At this point in the video, I'd like to ask you to like and subscribe if you like this kind of content. Moving on, one would ask, why are people getting this surgery? Well, the answer to that is not so black and white. There are many factors as to why somebody might get a Brazilian butt lift. Let's talk about them. Before we get into that though, I'd like you to know that the BBL is one of the most risky surgery procedures that you can have done, with a death rate being 1 in 3,000. This makes the decision to get a BBL quite daunting. One of the biggest factors leading to cosmetic surgery in general is body image. But before we get into that, let's talk about the factor of the fetishization of Black and Hispanic bodies. As a Black woman, I personally have seen white American society move from hating women with big butts to uplifting women with big butts. Get it? Uplifting in Brazilian butt lift. I remember watching shows and movies in my childhood and hearing the infamous line, "Is my butt too big?" Along the line, Black and or Hispanic women's bodies started to become desired on white skin. American society in general started to glorify Black bodies on white women. Yomi Adegoke, in her article, "Why Does the Black Butt Only Look Good in White Skin?" stated, "The era of the big booty neither started nor ever stopped for Black women. And even if it had, it wouldn't be the likes of Miley Cyrus, Iggy Azalea, and J-Lo that we would be attributing a rear renaissance to." Despite what the mainstream media told us, Black women never stopped aspiring to possess the curves that society so hated. Now, J-Lo is a Hispanic woman, but she's also a woman who has been known to profit off of Black culture and use Black women as a stepping stone to her success. But I digress. The thing is, Black and Hispanic women have always been celebrated in our own communities for having big butts. is one of our beauty standards. However, outside of our communities, we have been shamed for those exact same features. Now everybody wants big butts and big lips and a curvy figure, and it just feels like another form of appropriation. With the rise of the Kardashian clan, Fashion Nova, and Instagram modeling,
the big butt has gotten more and more desirable.
For those who don't possess the trait naturally, a butt lift becomes an option to get the body that they desire. This leads into another factor that we talked about earlier, body image. Our body image is influenced by so many things. It's the body we have and what we want it to be. It's who we are and how we feel about our shapes and features. Sawyer and Constantian in 2017 noted that consumers of popular television, magazines, and social media are regularly exposed to the image of the physical appearance of others. The end result is that consumers cannot help but be exposed to depictions of beauty, as well as the message that cosmetic medical treatments are a part of the path to physical perfection. You tend to want to be the beauty you see. Here's another interesting fact. According to an article by David B. Sawyer, studies from around the world have also suggested that between 5 to 15% of patients who present for cosmetic surgery procedures meet the diagnostic criteria for body dysmorphic disorder, or BDD. While individuals with BDD do not typically report a reduction in their BDD symptoms following a cosmetic procedure, the great majority of patients without the disorder do report improvement in body image. For clarification, BDD or body dysmorphic disorder is a mental disorder where you have persistent and intrusive preoccupation with an imagined slight or defect in your appearance. The possibility of having BDD is one of the reasons why it's better to do thorough research before getting cosmetic surgery. We all struggle with insecurities, but not to the same degree. What may seem minor to me could be the reason that you think you're not perfection. That's why I don't judge people when it comes to the reasons why they choose to do certain things with their bodies. It's their body. We've all been socialized in different ways. So if you've decided to get a BBL or any kind of surgery for your mental health or physical wellness, all power to you. Just please stay with me as I go over the risk of the procedure so that you can have all the information you need to make the best decision for you. As I mentioned before, the Brazilian butt lift is the most risky cosmetic procedure that you can have done. According to the American Board of Cosmetic Surgery, because the demand for the procedure is so high, surgeons who are not uniquely qualified to perform Brazilian butt lift surgery are offering it. And many patients are lured by low prices and false advertisements of experience. Unfortunately, the actions of these unqualified surgeons providing Brazilian butt lift surgery has led to a number of fatalities and high incidences of post-surgery complications, more so than nearly any other cosmetic surgery procedure. Some of us can't pay $6,500 for a butt lift surgery, and that's what these fraudulent doctors use to lure patients into paying them. Another notable risk factor is the possibility of gaining or losing weight after the surgery. Other potential risks include bruising, stretch marks, infection, blood clots, excessive blood loss, cardiac and pulmonary complications, deep vein thrombosis, fat embolisms. And a fat embolism is where fat is injected into the veins and it travels into your lungs. Complications associated with liposuction and anesthesia, and necrosis or fat surrounding the tissue. It's good to actually listen to all of these because if this was a medical ad, they would have been like, complication, blah, 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 blah. You know how they are. So if this is something you want, just, if you need to go back and listen to the risks again. Now that we've gotten through the risks, you almost have all you need to make a really informed decision that's the right thing for you. Let's talk about how to actually get a safe BBL done. First, seek therapy. We're all insecure about things, and usually those insecurities stem from emotional things that we haven't worked through. Talking to a licensed therapist might help you get a good grasp of why you want to perform cosmetic surgery, if it would actually be the best decision for you. Because what if you go to therapy and you find out that it stems from another issue, and changing your body would actually make you not like your body more. So it's just great to go to therapy for you to actually see into yourself and see what you actually want, and not just like what instantaneous decision you think will make you happy. Therapy is also important because you could have BDD and not realize it. Next, make sure you have the money for the surgery. Not having the funds could lead you to go to a doctor who is fraudulent or to go to someone who doesn't have much experience with BBLs. 3. Make sure that your surgeon is certified with experience in butt enhancements. Ask them about their credentials and actually look them up. Did you know that it's actually legal for any kind of surgeon to perform any kind of surgery in their office? That's why you should make sure you have the money before making this decision, because you don't want your money to lead you to a doctor. You want your safety to lead you to the doctor you need. Make sure you review before and after pictures of other people who have gone to the surgeon that you've gone to, so you can see how their work actually looks like. It's like Amazon reviews. If you don't watch the reviews and see what the product actually looks like, you will go in blindsided. You won't know what you're gonna come out looking like. After getting all this information, you might be wondering, should I get a BBL? And honestly, the answer to that is, it's your decision. You know yourself better than anyone else. And I've provided you with enough information to be able to make the best decision. I'll also link some videos of women who have gotten the BBL surgery here on YouTube, so that you can go and look into their experiences and see how that was. With that, we're at the end of the video. If what I said was interesting to you in any way, go ahead and like the video and subscribe. I make entertaining content, I make video essays, I make movie reviews, and I make social commentary videos. So if that sounds interesting to you, subscribe, subscribe, subscribe. I'm trying to grow my channel. And did you notice my nails? They're bad. Look. Yeah, not the best at all. But I had to do this video, you know. It could help someone, and that's all that matters. So tune in every Tuesday and Saturday at 9:15, or check back in around that time for my next video. And with that, I have to say bye.